On the 74th Independence Day celebrations, our Prime Minister, Mr. Narendra Modi, announced National Digital Health Mission. And from that moment, we all have been having many doubts. In this video, I will try to clear those doubts and I will try to break down the benefits, challenges, and the future prospects of this mission. So, let's get this started. Remember the last time when you couldn't find the immunization card of your 6-month-old? Or you have gone to the hospital and you realize that you haven't brought the reports with you? Or you are moving from one private hospital to another private hospital and they are making you do all the tests over again. All the same tests that you have done like 3 days back, they are making you do that again. Or you need to find the best cardiologist in your locality, like with some 15 or 20 years of experience. We all have faced these challenges, we all have faced these problems. And this National Digital Health Mission is going to solve all of those problems, all of those and many more. So what is this National Digital Health Mission? It is basically an EHR system. Mind you, EHR, not EMR. It's electronic health records, not electronic medical records. We think both are same, but they are not. All these big corporate hospitals like Apollo, Aster and all have their own EMR system. That is an EMR system. And they won't be sharing that info with others. Why? Why are they not sharing the information with others? Even though that could help the patient, that could improve the quality of life of the patient. That's because they don't want to lose the patients. They don't want to lose their patients to another hospital. So they obviously won't be sharing their medical records with the other hospitals. So that is what an EMR is. This one is going to be an EHR system, a decentralized one, which can be accessed by anyone who is having authorization from the patient. This EHR system will be having all the information, all your personal information, your allergies, your immunization, then your visit to the doctor, all the investigation that he did, all your previous diagnosis, all your pre-existing conditions, everything can be available at a single place. So in the future when you go to a hospital, you can just give your personal health ID and they can access all this information. Obviously with your permission only, because some OTP or a web link will be sent your personal mobile number, and with that you can give permission for anyone who is asking for it. It will be like that. That's how it was implemented in Rajasthan. What are the benefits other than making it more convenient for the patient? It's estimated that there is a loss of 300 billion US dollars every year because of poor data integration in the healthcare sector. Having a centralized healthcare repository, that's gonna help save billions of dollars for our government. Then it will be very helpful in the case of migrants. So you are a resident of Tamil Nadu and you are working in Odisha or you are working in Maharashtra, somewhere like that. So you have some procedure done in Tamil Nadu, like you had a hernia repair in Tamil Nadu and you are going to Maharashtra and the hernia is recurring. So instead of you yourself saying what surgery the doctor did, like what material he used and what was your diagnosis to the new doctor, you can just give your health ID and he can see all that for himself. He can see all the investigations, he can see the diagnosis, he can see the examination findings that the previous doctor had. And that is gonna make your life a lot easier. That's gonna streamline the process. That's gonna make the diagnosis, the new diagnosis, faster and the treatment faster. And we all have faced this problem. Nobody can read the handwriting of a doctor. Obviously, other than the pharmacist, no one else can read the handwriting of a doctor. So with the EHR, you won't be having the problem of reading the handwriting of doctors. And there have been occasions when a drug that was written by doctor was misread by the pharmacist and the patient took a different drug almost altogether. That's not going to happen with an EHR system. So now we have these problems of people buying the scheduled drugs without prescription and with fake prescriptions and all. People are buying that, or they are just giving the same old prescription and getting more refills. So this can't happen with this EHR. If this EHR gets implemented everywhere, then scheduled drugs can only be bought with a proper prescription, and there will be date in that EHR prescription. So for those dates only you can get the drug. After that you won't be able to get the drug. You have to get a second prescription from the doctor. So this is gonna reduce the misuse of antibiotics and other drugs. And in the matter of online pharmacies, it's gonna be easier for them to provide scheduled drugs, scheduled prescription drugs, because they are having the prescription. They can access the prescription and they can deliver the drug to them. You all might have faced this situation. You go to the doctor today, he does the examination and he advises you to take a USG or a CT or something like that. And you go and get that done, and you can't go back and give the report on the same day. And you might be traveling some 50 or 100 kilometers to go to the doctor in the first place. So what you will do is you will give the investigation, then go back, then come the next day, get the investigation and show it to the doctor. That's waste of a lot of resources, time and money and everything. So once this EHR system gets implemented, what you can do is you can give the investigation, go back home, then at home from your smartphone or a digital device, grant access to your healthcare provider, to your doctor, and he can check the investigation as it comes, because the laboratory will be uploading the investigation to your personal health ID. That is that streamlining. You don't have to go to the lab, collect the report and show it to the doctor. The lab will directly upload it to your personal health ID and the doctor can see that. So this is gonna save a lot of time and money to you. As I mentioned earlier, there is this information blocking. That is, private hospitals, one private hospital won't be giving the records to other private hospital or to the government hospitals. But with this EHR, they can't do that. It's a decentralized one and anyone can access it with your permission. So it will become easier for you to shift from one private practice to another private practice, or from private practice altogether into government practice, without any hassle and without having to spend more money on the investigation that you already did. You all would have faced the problem of you misplacing your records or your records getting torn or damaged. So that won't be happening with this EHR. One big change that is gonna come is in the field of insurance, the claims and everything. So now when you want to take an insurance, the insurance company, some representative will come and they will do a medical examination and they will fix a premium for you. With this EHR, you don't have to do that. So what you can do is you can just give your health ID to your insurance provider, to a private insurance provider, and they can access your previous healthcare data and they will know what they are signing up for, if the patient is already having some pre-existing conditions and all. Then in the matter of claims, now what happens is that when you go to a hospital and provide the insurance card, what they will do is their HR team or someone will contact with the insurance provider and a representative will come. They will check all the information. Then after some time, the claim gets approved. So this will take some 3 days, 4 days, and if some problems is there in traveling or if some holiday was there, it's gonna take more time. So it's not a very good way how the claims are happening presently in our country. With the EHR, the claims will happen just like that, very fast and streamlined. Then in the matter of insurance frauds, that's gonna disappear altogether. There won't be any frauds in the matter of insurance. Why is it that? Because these records are gonna be in blockchain. I will talk about blockchain like later. And one of the greatest benefit is in clinical research and policy implementation. So you are having all this data at one place. What this will do for clinical research is it's gonna be really easy for you to access this data. With the click of a button, you can get the data. Obviously with the permission of the patient. So what will happen is like, now the researchers won't be having to spend a lot of money in collecting data and all. They can provide some benefit to the patient, like give some money to the patient for participating in a research, and they will be more than willing to share their health ID with you, and it's gonna make clinical research a lot easier. And in the matter of policy implementation, healthcare planning and implementation, what happens is that with this data, we can give a personalized plan for different states, different districts, because with this data, you can see that where the immunization program is lacking, where such and such disease is more, where some plan is failing. You can see which district, which block, where the problem is happening, and you can implement new plans, new strategies according to that. Just for a particular district you can implement a plan because you are having the data where the problem is happening. So it's going to make clinical research, healthcare management, planning and implementation a lot easier and more effective. So in this video, I talked about the benefits of National Digital Health Mission and EHR as a whole. In the next video, I'll be talking about the challenges faced by National Digital Health Mission and the future prospects and where we are standing now in the matter of implementing this policy. So to see that, please subscribe to my channel and ring that notification bell so that you will know when I'll be uploading the next part. And if you like this video, leave a thumbs up and share it with everyone who needs to know about this. Bye, till we meet again.